we are reporting a case of a 37-year-old female following short-term exposure to fenfluramine use before surgery for morbid obesity. Echocardiography done on the patient revealed regurgitation of mitral and tricuspid valves with tattered chordae were also shortened, and a severe pulmonary hypertension. At the surgery, the affected leaflets of the affected valves leaflet had a glycerin white appearance with yellowish, without the usual yellowish discoloration that is associated with rheumatic heart disease, and it wasn't calcified. The patient had both valves repaired with intraoperative transesophageal echo showing good results. The picture of the echo before and after the surgery will be shown later. At the surgery, the affected, next slide. Histology of the excised part of the leaflet showed surface proliferation as against the typical, and fibrosis as against the typical calcification that you find in rheumatic heart disease. The use of anoretic drugs, either singly or in combination, has been associated with unusual cardiac morphology and resultant regurgitation of left and right-sided heart valves. And the prevalence of significant valvular disease associated with the use of these drugs have been reported to be as high as 23%. And usually it's associated with long-term use of the drugs. That drew our attention to the report of this case that just had 1 month use. The first report of a case of this nature was in 1997 by Connolly and his colleagues from the US. Most cases of valvular heart disease associated with fenfluramine use have been attributed to long-term exposure, like I said earlier. And surgical repair has not been a common mode of treatment because from the finding of previous authors, it's shown that when the drug is stopped, most of the cases recover. But we found this unusual case, even after about 5 years of stopping the drug. This case highlights the occurrence of severe multivalvular regurgitation following short-term exposure and a successful surgical repair. Next slide. This shows the slide, the echocardiography done on the left before the surgery, before the repair, and on the right after the repair. You can see that on the left there is severe mitral regurgitation, and then on the right, minimal regurgitation post-repair. Thank you very much.